My daughter was a normal 6th grader who ate hot lunch in the cafeteria every day. However, soon after she ate, she would start to feel sick. She would either have a stomach ache or a headache and even throw up. She thought that she was getting sick from the stress of school, but she kept having stomach aches and headaches, especially after she ate. I felt it was time for her to see a doctor, so I made an appointment to see our family pediatrician. He examined her and didn't find anything wrong, but he didn't seem too worried about it. He didn't seem like he wanted to probe deeper to really find out what was going on. At this point, I started talking to friends and family about my daughter. My brother-in-law, who lived in California at the time, suggested we talk to a friend of his, Dr. Wang, who was a naturopathic doctor. We set up a phone consultation with Dr. Wang, and she asked us question after question and probed really deep about my daughter. She was the one who put the pieces together for us and suggested that she was celiac. Kids that are celiac have some symptoms that adults don't have, such as growth problems. My daughter had a growth problem, decreased appetite and failure to gain weight, chronic diarrhea, chronic constipation, vomiting. My daughter had this all the time. Abdominal bloating and pain. She also experienced this. Fatigue and irritability. She was a little bit irritable. There are also going to be behavioral problems like ADD and anxiety. She had both of these. There can be skin problems like acne and brittle nails. She had acne. Other problems can be asthma or bladder infections. She had asthma. You could have oral problems like bad breath and gum disease. You could also have intestinal problems like acid reflux. Thank God she didn't have that. Joint and muscular problems. She didn't have any of those, like leg cramps. You could also have vitamin deficiencies like anemia, low calcium, low vitamin B12, which she did have because Dr. Wang tested for all that. So at the age of 12, we scheduled a biopsy of the intestine for my daughter. My daughter had this done, and the results of the test did show that she was definitely celiac. So now we had a diagnosis, and we knew what was going on. But with this diagnosis, we had all sorts of questions. The main question we had was, what can I eat? Other questions she had were, what does it mean to be gluten-free? What exactly is gluten? What does it mean to be celiac? We had all sorts of questions, and they seemed never-ending. My big question was, how is it going to affect her lifestyle and also the lifestyle of our family? Being gluten-free means not being able to digest gluten, which is a protein found in grains such as wheat, barley, and rye. Gluten is also hidden in many products and you need to read labels to make sure that something is truly gluten-free. I now read all food labels to make sure that something is gluten-free and there's no gluten hidden in it. You also need to make sure that the product is not produced in a plant that contains wheat. But the big question my daughter had was, what can I eat and will I be able to eat like other kids? Living a gluten-free lifestyle is not easy, but it is also not hard. There are many companies that make gluten-free alternatives that taste good. There are also many restaurants that have gluten-free menus and gluten-free food choices. Eating gluten-free can be as simple as having a piece of grilled chicken or a salad with no croutons. It can be a hamburger without a bun. Eating gluten-free in social situations is another story. It's a lot harder. Most people only think about the diet aspect of going gluten-free, but not the social aspect as well. Food is involved in almost any social get-together, especially for teenage girls. My daughter tells friends and family that she can't have gluten or she brings her own food. We found that most people are understanding if you just tell them about your needs. Either way, going gluten-free is a lifestyle change. There is no cure for celiac disease. The only treatment is a gluten-free diet. In celiac disease, patients vary in their tolerance with gluten. Some patients can ingest small amounts of gluten without feeling sick, while others can ingest a small amount and feel totally sick. The standard treatment calls for a complete avoidance of gluten for life. The principles of a gluten-free diet include avoiding all foods made from wheat, rye, and barley, like your breads, your cereals, your pasta, crackers, cakes, pies, cookies, pizza, and even gravy because gravy's got flour. Avoiding oats. Oat can be contaminated with wheat, so avoiding oats is definitely a must. Also pay attention to processed food. Wheat flour is a common ingredient in many processed foods. Once again, you need to read your labels. My daughter will be celiac for the rest of her life, and a gluten-free lifestyle will enable her to be healthy. You can still enjoy eating food being gluten-free. My daughter's been gluten-free for over 4 years, and gluten-free food is as good or better than regular gluten food. People assume that going gluten-free means you can never enjoy food again, which isn't true at all. In fact, going gluten-free allows you to enjoy food more. You'll be able to eat without getting sick, and you'll enjoy your food. Luckily, there are gluten-free alternatives to pretty much anything now. You can still enjoy food as long as you're open-minded and realize there are so many options for you to enjoy. My daughter is much happier and much healthier in a gluten-free diet, and you can be too.